can we start the session?
Yes, sir.
Let's start.
Okay. Okay, let's start. Good evening, everyone. I am Leo Neil Raut. Welcome to Rethinking. Rethinking, this is a collab between Leo Club of Navi Mumbai, Project U, and MySafe Therapy. It is a series of interviews and or seminars which aim to tackle various mental health issues and general mental well-being to make people more aware and about mental health disorders and destigmatize them in the process. In our first installation of Rethinking, we are rethinking depression. Our aim is to understand and change the notion and perception of this word. We address this with a series of questions compiled with the help of our writers, our psychologist, Ms. Yusra, and you guys. We hope this brings some clarity on the subject and help you guys understand it better. Before moving on to the interview, we'd like to introduce ourselves, starting with Leo Club of Navi Mumbai APMC. We have the club president, Leo Nupurraya.
Thank you, Neil. Good evening, everyone. This is Leo Nupurraya, president of Leo Club of APMC, and I would be giving a short introduction of this organization. Leo stands for Leadership, Experience, and Opportunity. Community services remain the cornerstone of the program, fostering a lifetime commitment to help others. Our objective is to provide the youth of the world the opportunity to development and to contribute individually and collectively as responsible members of local, national, and international community. Our club, Leo Club of APMC, is an integral part of this global organization. Established in 2019 by our parent club, Lions Club of APMC, we took baby steps in the world of community services. Beginning with tiny service activities, we started venturing into remarkable projects like Nanhe Parinde, where we visit local slum areas and spend time with kids there, teaching them basic English mannerism, etc. This is a small effort to bring them into our mainstream. Our club has also done remarkable projects like menstrual hygiene seminars for underprivileged girl students and distribution of menstruation kits, medical camps, say no to plastic campaigns, contribution to Assam Relief Fund, distribution of sanitization kits in slum areas in the wake of pandemic, and many more. And yes, there is a lot more to do. Today's seminar is just one more effort to make this world a more better and a beautiful place to live. Thank you. I would like Ketan to take ahead and give Project U an introduction.
Thanks, Nupur. So, hi everyone. I am Ketan from Team Project U. Basically, we are a group of undergraduate students who have come together with the aim of helping our healthcare professionals deal better with their mental health. So, in this period of the pandemic and in general, healthcare workers are overworked, overwhelmed, and they rarely have some time for themselves. So what we have done is we address the mental health issues that they might face, the difficulties they need to overcome, and we have created one single platform with all the resources that they might need. So we have selected compiled resources that they can use. And this is a platform that we are continuously building. So your support and feedback as our viewers is very important to us. So that was about Project U. Now let us cordially welcome our speaker for today, Ms. Yusra Sayed. She is currently working as a counseling psychologist and has done her master's in psychology with specialization in child psychology and children development. She has published several research papers at the national and international level and has worked with special kids as a special needs teacher. She has started My Safe Therapy with the aim of providing no-cost counseling, especially to the ones who cannot afford therapy. Ma'am, could you please tell our audience a little more about My Safe Therapy?
Yes, thank you, Ketan. Good evening, everyone, and thank you for joining us today. Myself, Yusra Sayed. I'm a counseling psychologist. I started My Safe Therapy with the aim of providing counseling services to those who cannot afford therapy. I strongly believe that financial troubles shouldn't stop someone from seeking treatment. We are also glad to announce that very soon we will be launching our online workshop and internship programs. And I hope towards the end of this session, you are in a better position to understand depression. Thank you.
Okay, so I would like to go back to what ma'am said. My Safe Therapy is a platform with free counseling and therapy for everyone. So even our viewers, if any of you feel like after this session you want to approach ma'am with any issues you might face or need her guidance or counseling, please feel free to approach her. Her Instagram handle and email ID, I guess, will be given in the post-event questionnaire that you guys need to fill. So now let's start. Thank you for so much for joining us today, ma'am. Let's start with the questions.
Yes.
So all these questions, some of them we have written ourselves, and most of them we have compiled from the feedback that we got from our viewers. They were given a pre-event questionnaire. So the ones which are most frequently asked or the unique ones, those we have compiled today for you to answer. So let's start. Um, what exactly is depression? How do we know that someone is going through depression? What are the signs or symptoms that one should look out for?
Yes. So, to start with, depression is a serious medical illness. It negatively affects the way you think, the way you feel, and the way you act. It also impairs your ability to function normally and can lead to a variety of emotional and physical problems. Now, you have to understand that the symptoms of depression can vary from mild, moderate to severe. And for a person to be diagnosed with depression should have at least 5 or 6 of the following symptoms, and they should persist for a period of 2 weeks or more. So now we will address some of the common symptoms of depression. Firstly, feelings of hopelessness or helplessness, feeling guilty or worthless. You tend to have suicidal thoughts or you think about death. There is tiredness within you. Your body tends to feel very heavy, and even completing the smallest of the tasks may take a longer time. By this I mean that even just getting up from your bed may really take a lot of time. You may not even feel like brushing your teeth. After that, there is a change in your appetite. That is, you may either overeat or you may stop eating. There is a change in your sleep pattern. That is, again, you could be oversleeping or you have trouble in sleeping. There is anger or irritability. You tend to feel restless and your tolerance level becomes very low. There is a loss of concentration and you cannot take your decisions quickly. So these are some of the symptoms of depression. Now, let me tell you that some of these symptoms you may experience in your daily life. Occasionally, you tend to get angry. Occasionally, you tend to feel irritated. You may feel guilty about something. But it is the number of symptoms you have, the longer they last and the stronger they are, can lead to a diagnosis of depression. You must also know that depression can occur in men as well as in women and also in children. Thank you.
Okay, I think the next logical question would be what are the causes of depression?
Okay. Now you understand that depression is an extremely complex illness. We do not really know what causes depression, but however, there are certain reasons that can lead to it. For example, continuing difficulties like a long-term unemployment or living in an abusive or uncaring relationship, work stress. Now, these, if they are persisting over a long period of time, yes, it could lead towards depression. Also, recent events such as loss of your job, or if you have failed your exam, you had a breakup or a divorce, this could again lead towards depression. Now, your family history also plays a role in this. Yes, depression runs in family, but it does not necessarily mean that if your parent has depression or if your close relative has depression, then it is going to pass on to you. No, your life circumstances and your personal factors also play a role here. Then let's talk about personality. If you are someone who has a tendency to worry a lot, if you're a perfectionist, if you have low self-esteem, or you are very sensitive to criticism, then there could be chances that you're drifting towards depression. Again, a loss of your loved one could be another reason. Currently, I see financial crisis as being one of the major reasons for people getting into depression. Then there is also drug and substance abuse. Now you have to, drug and alcohol abuse. You have to understand that substance abuse could be a tricky one here. It can either lead you towards depression or it could result from having depression. Also, the events which look good. Okay, now suppose you have got admission into your desired college, or say your admission into your desired college, or you're getting married, or you have got your dream job. Now, these events tend to look very good to you, but they can also lead toward depression. Now, while we are addressing the causes of depression, you must know that depression doesn't always need a reason. You may have asked your friends or your relatives once at least that, why are you feeling so depressed? And the most common answer you may get is, I don't know, I don't understand, or nothing. Yes, that is because a vast majority of people with depression do not know why are they feeling this way. Okay, the common notion which people have is that if you have depression, you have to justify it. You have to tell me a reason why you have depression. Especially if you see a person who's doing financially very well, who has an excellent support system, who is well employed, you may say that no, that person has no right to be unhappy. But you have to understand that every individual is different. So these are some of the causes of depression.
So now I would like to ask, since in the beginning of this answer you said there are no clear-cut or well-defined causes of depression. So from a third-person perspective, how can we differentiate between someone going through depression or someone going through, let's say, a sad patch?
All right. Now there's a clear-cut distinction here. Depression is a mental illness. Sadness is an emotion. Sadness is a normal human emotion which all of us have experienced, and we are likely to experience it again. It is usually triggered due to a challenging or a hurtful experience or a situation. It is a normal human reaction to anything that has caused you pain. Yeah. So these feelings of sadness tend to fade away when we have adjusted to that particular situation, or when we have gotten over the loss of it. Now, depression altogether is a different thing. Depression is a longer term mental illness. It affects all aspects of your life. Okay, you may no longer find enjoyment in the things you would earlier enjoy. It affects your occupational, your physical, emotional, all aspects of your functioning. And moreover, when you have depression, you are sad about everything. So sadness is just one element of depression. Also, you may notice that when you are sad, and if you're feeling sad about something, so you cry or you vent out or you talk about your frustrations, you tend to feel better. But this is not the same case with depression. However, if you feel that your feelings of sadness are not going away, and along with this you're developing other symptoms of depression, then it could be a sign of depression and you may need professional help.
Okay, so if we know what depression is, do you think it is preventable, and if yes, how can it be preventable? How can it be prevented?
All right. Now, depression is not generally preventable. We have not even recognized the clear causes of depression, so preventing it is out of question. This is normally because some of the causes of depression are not in our control. People cannot control, okay? They go into depression maybe due to a major life change. Now, this is not always in our control. We cannot protect ourselves from these factors. But yes, if in case you were diagnosed with depression earlier, or if you had an episode of depression earlier, you can make certain lifestyle changes that will help you to lead a healthier life. Now, this is not only for people who have been diagnosed with depression, this is for all of us, because a healthy life, maintaining a healthy lifestyle definitely keeps you healthy. So some of the tips could be exercise regularly. By exercising regularly, I don't mean go and enroll yourself in a gym. Do anything, any physical activity that you enjoy. Could be jogging, cycling, dancing, anything. Because when you exercise, you're releasing the feel good chemicals. Apart from this, you have to build and maintain strong emotions. Now, having adequate support is seen as one of the best factors that protect you from depression. So, get in regular touch with your friends and family. Then, reduce your stress. Avoid overcommitment to things. Okay, and understand that certain things are not in your control and you have to let them go. You cannot sit with it, you cannot stress much on it because it's not going to change. Stay away from toxic people. We all must have encountered that one person in your life who has always put you down, who has made you feel worse about yourself. Cut them off straight away. You do not need them in your life. Now keep a check on your diet. Now, when we talk about diet, we usually talk about your physical appearance. No, having a healthy diet affects you and has a great impact on your mental health as well. Incorporate in your diet vegetables, fruits, and lean protein. Avoid items with high sugar, processed foods, and refined foods. Apart from this, you have to understand what are your triggers. Okay? For example, your job itself may be a trigger to you. You do not like your job. You don't like going to your work. But now what you can do, you cannot leave your job. Because of your own reasons, you cannot leave your job, right? So you know that your job is your trigger. So you have to be prepared for what it's going to do to you. Another unavoidable trigger could be the death anniversary of your loved one. You cannot skip that date. So you know when that date is approaching, how you're going to feel about it. So ask your closed one or someone to check on you. Have a belief in yourself that this is going to pass. Then try talking therapy. When I say try talking therapy, some of us get comfortable in talking to our friends and family, while some do not. Some resort to a trained stranger. I'm stressing on the word trained stranger because I'm referring here to a therapist or a counselor. Do not just go to any random stranger and tell all your problems. It's not going to help you. And lastly, your sleep. Now, sleep plays a very important role. 8 hours of sleep is very effective for a good mental as well as a physical health. Try to maintain a bedtime routine. That is, clean your area where you're sleeping, maintain a tidy sleeping area, clean yourself. Don't go to bed in the same clothes which you have been wearing since morning. Just change your clothes and then go to bed. Avoid using your mobile phone right before closing your eyes. Practice breathing exercise. That is, breathe in through your nose and breathe out through your mouth slowly. So these are some of the lifestyle changes that can help you to lead a healthier life.
Okay. So we know that constant levels of high stress or low levels of motivation, confidence, or even self-esteem, somewhere these factors will lead to depression, especially among medical students. So how is one supposed to stay motivated and cope with these difficulties?
All right. So if you're specifically talking about medical students, you have to understand that a quarter of medical students deal with depression during their medical journey, somewhere during their medical journey. Okay. Now, this is because they are dealing with various stressors on a regular stressors such as academic requirements, assessments, large workload, especially an additional pressure of clinical practice. Now, during such times, see, you cannot escape reality, right? You have to face it. So here we suggest a few strategies for you. One could be positive reframing strategy. Now, what happens is if you have a day where you are very stressed out and it's very overwhelming to you, you can try to positively reframe that situation. Now, positive reframe strategies remove the stress from the stressors. Okay. So now, instead of looking at the situation with only threats, you will look at that situation with new possibilities. So the first step could be examine what is stressing you. You have to particularly identify that in that particular situation, what is that one element that is stressing you? It could not be that the whole situation is stressing you, or it could simply be that one particular thing about that situation is stressing you. So you have to identify that and see that where you are lacking control over it. Secondly, look for what you can change. Now, when you're looking for what you can change, you have to brainstorm a number of possibilities. Okay, so while you're brainstorming possibilities, don't think that whether you can do it or whether you cannot do it. So instead of thinking, how can I change this? Sorry, instead of thinking, I wish I could change this, you have to say, how can I change this? Now, understand that you may not be able to change every situation, right? But at least when you are positively reframing a situation, you may come up with a number of possibilities which you were earlier not aware of. Then look for benefits. Now, if you are in a situation which you cannot change at all, then look for what benefits you will have after you're facing that situation. Okay, you may be able to gain some strengths from it. Now, for example, let me give you my example. I fear facing camera, but I was committed to this workshop and it was a stressful situation for me. But now I know that after I've participated in this, now I'm talking to you guys, I will overcome my fear of facing the camera. So this is a positive strength that I'm regaining from this situation. This is about positive reframe strategies. Then you have something called as acceptance-based thinking. Now, what do you do when you cannot change a situation at all? You have to accept that situation. So instead of dwelling on what has happened and crying about it, you have to accept it without any judgment. Okay, do not be harsh on yourself. Acknowledge and understand that these are not the outcomes that you wished for. You didn't want it to happen this way. But now you have no option, so you have to simply accept that situation. Breathe through the feelings of frustration and anger, as this really helps, and see what you can do next. And lastly, don't be stuck in that particular situation. Understand that it passes. You at present, when you are going through it, you may not be able to think that it's going to pass. But yes, every situation passes. Give it time. Or else, if you are stuck in that situation, it's only going to worsen your condition. Now, some of the motivation tips specifically for our medical students could be: break down your workload, manage your time, set your priorities. This way, you may be able to stay on track. Then look at your longer term goals. Okay, like test is always recoverable. You can re-answer that and pass that test. But if you lose the track of your career, then it can be very damaging. Then picture yourself as a doctor. I'm sure that is the ultimate motivation of you joining your medical field. So picture yourself helping a patient, or how you would be as a doctor. And lastly, don't compare your journey to someone else. You're always ahead or behind of someone. So stop comparing your journey. And if you feel that you're feeling overwhelmed, you cannot do anything right now, take a break. Take a break of a day or a two, but get back on track.
Thank you for sharing a personal experience with us. The next question is, in a highly competitive environment, like an academic setting, let's say, or a medical work in medical practitioner in this pandemic, a corporate setting maybe, it may lead you to believe that if you have depression, or if you are feeling depressed, that means you're weak or not worthy of your position. Could you explain why taking help is necessary in such situations?
All right. Firstly, you're already worthy. You do not have to do anything differently to prove your worth. You don't have to prove anyone that how valuable you are. Okay, irrespective of your medical illness, irrespective of your employment status, you are still valuable. So do not, weigh your worth in terms of your other factors. Then, if you're talking about seeking help, now taking help is necessary because support plays an essential role to protect you from depression as well as overcoming depression. Okay, now when you are fighting alone, you may not be able to maintain a healthy perspective. All right, and you may be just beating yourself down, and you may think that there are no options available. But when you seek help, the people advise you, people may take you to mental health professionals also. Then, but you also have to understand this, the very nature of depression may stop you from seeking help. Okay, you may feel exhausted all the time. You may want to isolate yourself, or you may be ashamed of your situation. Okay, but understand that this is only your depression that is talking. Also, reaching out for help is not a sign of weakness. In fact, it is exactly the opposite. It is the strongest thing which you can do. Reach out to someone whom you feel, around whom you feel safe, around whom you feel cared for. That person does not necessarily have to fix you there and there and solve all your problems. No, that person just needs to be a good listener who is listening to you with a lot of compassion and no judgment. And if that is also not working to you, if you're not comfortable going to your loved ones, then professional help is right next to you. Okay, see, when you break your arm, you visit your doctor. When you have a stomach ache, you visit a doctor. Just the way, if you have depression or if you're developing symptoms of depression, you again visit a mental health professional. It could be a psychiatrist, could be a counselor, psychologist, or a therapist. That's it. So that's how simple seeking help is.
Thank you for that answer, ma'am. Now, focusing on working medical practitioners, how might depression affect their clinical practice? Because the general trend is that their reputation is of utmost importance. That is the final thing that actually brings a patient to them. So somewhere they are scared that if word gets out that they are visiting a therapist or they are suffering from depression, it will somewhere damage their reputation, and colleagues will stop sending them referrals, and patients themselves will stop coming to them. So, any tips for such a situation?
All right. So when talking about how depression can affect your clinical practice specifically, see, there are two things to this. One thing is presentism, the other thing is absentism. Now, in presentism, what happens is you're physically present at your work, but you're not engaged in your work. All right. That is you, and especially in clinical practice, you cannot take chances of not staying focused. One wrong decision could cost you a life. You have to constantly maintain healthy social and healthy social interactions and communication with your colleagues and patients. So this is all about how depression can lead to presentism in clinical practice. Now, absentism is that you're missing your work and you're not attending your job. Now, what happens is when you don't talk about this, your colleagues don't know, right, what you're going through because you haven't told them. So they may think that you're procrastinating, you are not focused, you have become very lazy, you're not interested in work. Now, this questions your ability, this questions your work performance, whereas that is not the truth. So you have to, in this case, you have to be vocal about your depression, you have to own it. Go to your employer and tell them that you are suffering from so and so things, and when you are sick, you take a sick leave, right, for any other medical illness. Depression is also a medical illness, so take sick leave for that. And when you're talking about reputation, see, if you're talking about clinical practice, if doctors themselves don't understand depression, what are they going to teach others, right? So awareness is the key here, and I think it's just lack of awareness and lack of education that makes people think that their reputation will get affected. At least once try talking and then see what happens. Not, if the world definitely has kinder people also.
The next question is whether a person, even if he's depressed, can he still work and function more or less normal? Like he seems normal on the outside, but he may be depressed. Is that possible?
Yes, it is possible. See, depression is not one size fits all. Okay, two people with depression will have completely different experiences, right? So you do not know what happens here. So this way, when your symptoms are less severe, okay, if they are mild or they are moderate, you may be still able to function normally. You're going to your work, your school or your college, you're completing all your tasks. Also, you are maintaining your relationships. So when this is the case, people cannot identify whether this person is really depressed. But inside, that person is screaming, that person is going to bed crying, he wakes up crying, that person is not sleeping well, but maybe also functioning. Okay, now this is a very dangerous sign of depression because it is not easy to detect, and if it is not detectable in the first place, then how can you treat it? Okay, now when I say this person is functioning, I'm not saying that this person is functioning to its full potential. Okay, he is not fully functioning, there is still some impairment, but it may not be noticeable. Also, the person who is suffering may not realize or may not recognize that his constant state of sadness is actually a sign of depression. Maybe a loved one who notices some changes in the person could address the and get some help. Also, I mentioned that it is not easily detectable. This kind of depression can persist over years. It can go up to 1 year, 2 years, and you may still not know that you're living with it. Thank you.
Okay. Ma'am, the next question is depression treatable? Like if we are treating it as a disease, as an illness, is it treatable? And if yes, what are the sources of treatment available?
All right. Fortunately, yes, depression is treatable in most of the cases. Now, just as I said that no two people can have same experience of depression, there is no specific treatment that will specific treatment for all the individuals that will cure the depression. It's not like you have headache, so you just take Crucin or something and you're fine. It doesn't work that way. Okay, so like there are different treatment options available here. One could be medication, the other could be psychotherapy, and the next could be lifestyle changes or having self-help, learning self-help coping skills. Now, talking about medication, it depends on the severity of your symptoms and the severity of your condition. There are plenty of antidepressants available, okay, but you may need to try several medications before understanding which is fitting you the most, which is working for you. It could be one antidepressant or it could be a combination of different medications. Now, while talking about antidepressants or medications, you must know that if you are under this medication, you should not stop it abruptly. Okay, because stopping it suddenly can worsen your condition. You must consult your doctor, and you may seek ways of either reducing the dosage or looking for alternative treatments. Also, understand that medication can be prescribed only and only by a psychiatrist, not by a psychologist, a therapist, or a counselor. Then the next form of treatment which is available is psychotherapy. In layman's term, it is called as talk therapy. Now, this helps you to step back and recognize that what is contributing towards your depression. So, your therapist or your counselor may help you to recognize all the negative beliefs and how you can look at it in a much more positive way. They help you to adjust to your present difficulties. Okay, they teach you certain ways to and different coping skills to solve your problems. Now, while seeking therapy, remember that you cannot expect a miracle in the first session. This is this is a common problem. Okay, people go to therapy for one session and they expect a miracle, and when that miracle doesn't happen, they think that therapy doesn't work. It's not like that. Give yourself some time. You may know, knowing your condition, you may need a number of sessions also. When you're talking about therapy, you could also be in group therapy or individual therapy. Individual therapy is a one-on-one therapy with your therapist. Okay, and a lot of people are comfortable in this because they can share sensitive information. In group therapy, what happens? You are listening to your peers who are also going through a similar phase. Now, this validates your experience, and this also contributes towards socialization. Then, when we spoke about lifestyle changes, as I said, stick to your treatment plan, follow your treatment plan properly, recognize that it is going to take some time to show results. Learn about depression. You need to educate yourself about depression so that you are able to identify the warning signs and symptoms of it. Okay. Then avoid alcohol and drugs. You may say that no, if I'm drinking, I'm feeling better. Yes, at that very moment, maybe after drinking, you definitely felt better. But in the long term, it will only worsen your depression. Then be physically active. adequate sleep is important, as we have discussed this earlier. Now, there are also some mind and body techniques which people resort to, like acupuncture, meditation, yoga, spirituality, music or art therapy. Now, this works, but do not be solely dependent only on these, because this is not an effective treatment for depression. You can follow these techniques along with your medication or psychotherapy. So yes, there are adequate facilities available. You just have to reach out to it.
Okay. I think this is the last question. Is even in today's time, talking about mental health is still considered a taboo. So, how is one supposed to overcome the stigma around depression?
Okay. Now, stigma causes people to be ashamed of their condition. All right. And they are in this condition not because of they are volunteering to be in it. Okay. It is something out of their control. And also, the worst part is stigma prevents people from seeking help. All right. Now, people from depression are already going through so much, and the stigma surrounded by it adds to their already existing pain. So, some of the different ways in which you can overcome stigma is talk openly about mental health. You discuss everything, right? You may discuss college life, you may discuss sports and stuff. Talk about mental health as well. Use your social media, post daily snippets, post something about mental health. Okay, if it reaches even one person, trust me, it is worth it. If even one person is benefited from that. Now, just to address this, now with the recent sad demise of Sushant Singh Rajput, a lot of people uploaded posts on mental health, that we are here to help you. People try to spread awareness. Okay. Now, the next day, there were people who were criticizing it. They were saying, okay, so yesterday's bakers have become today's mental health advocates. Like, why not? Why can't you be a baker and a mental health advocate also? So ignore such people. Focus on what you feel is right and post a lot about mental health. Then educate yourself and others and take every opportunity to do this. Okay. Wherever you hear people passing comments or so, and if you feel those comments are regarding mental illness or they're making fun about it, talk to them. Gently intervene and tell them that no, this is wrong. You're just adding to the stigma of this. Maybe they did it unintentionally. Maybe there was lack of awareness and they didn't know about it. So take every opportunity to educate people. Then be conscious of your own language. Now, when it comes to mental health, your language matters. Okay, the words you use matter. Like if suppose your friend has a breakup, you're going to say, "Ha, abhi ye depression mein chala jayega." How do you know whether he's going to go in depression or not? Or even if he is developing certain signs of depression, he may definitely not reach out to you then. Also, you talk about this, right? Very commonly, you might say, "Ha, na bhi abhi suicide kar le." Suicide is not a joke. Suicide is a real problem in today's world. So be conscious of your language and what you're using. Okay. Then encourage equality between physical as well as mental illness. You don't be rude or you don't make fun of someone with cancer. You don't make fun of someone with a chronic heart disease or diabetes, right? They might make fun of someone with a mental illness. That is also, so be equal, okay? Understand that having a mental illness is also as serious as having any physical disability. Then, show compassion towards people with mental illness. You just have to be kind. It doesn't even cost you. Trust me, taking a small step towards this can make a whole lot of difference for them, because not many people approach to them in a compassionate manner. Then the best way to fight stigma is to be very honest about your own treatment. Okay. Now, if you tell, right, that okay, I have an appointment of a dentist today. Or you say, I have developed skin problems, so I booked an appointment with a dermatologist today. Why can't you say I have an appointment with my therapist today? There's nothing wrong in saying that. Okay. So be vocal. It starts with you. Instead of expecting everyone around you, first try to change yourself. Then let the media know when they are stigmatizing. The common understanding of what people have of depression is, what we see in media is that a depressed person is with a bottle of alcohol in his hand. He's very shabbily dressed. He's either crying or he's sitting in a dark room. No, this is not the case with everyone. Everybody deals with depression in a different manner. So whenever you see any program which is making fun of people with mental illness, could be intentionally also, bring it to their notice, write to them, use your social media and tag them. Trust me, it works. And lastly, don't harbor self-stigma. Okay, don't hide from this world thinking that you will not be accepted. Okay, so instead you could try to be a productive member of the society. You could set an example to other people that yes, you can still lead a meaningful life even if you are battling a mental illness. So these are some of the ways in which you can try to overcome the stigma around depression or mental illness. Thank you.
Thank you. I think many of us can implement a lot of things you said. We would actually like to hear if you have some message for the audience of the session, some personal message.
Personal messages. Now, see, we all of us are dealing with this pandemic. A lot of us are affected due to different reasons. Some of us have lost their jobs. We are stuck at home, or we are stuck in family. Okay, not everyone is comfortable living with their family. They could have other issues also. So try to reach out to people. It doesn't take anything to leave one text and see how the person is doing. As I said, how the steps to overcome stigma, use your social media account, try doing that. And the main and the most important message which I always give is be kind enough. It doesn't cost you at all. You do not know what the other person is going through. You have not been in his place. So instead of just passing rude and hurtful comments, think about it how you will feel when those comments are passed on you. So that's it. Just be kind, be aware of everything, keep a check on your closed ones, and be yourself. And take care of your health, be it your physical health as well as your mental health.
I think we have ended early. Do you think we can take some questions from the audience, if you're fine with it?
Yeah, sure, no problem.
Okay. Wait. We have a question. If one of our friends, we know if one of our friends is depressed, what do you think we should do to help him with it?
Okay. So that is, you're saying that if you know one of your friend is depressed.
Depressed, yeah, and he's taking therapy and also, but what we can do to help him?
Yes, you can, as a friend, you can keep a check on him, see how he's doing. Make sure that he's attending his therapy sessions, he's not missing those. Also, try refraining from giving advice because you are not a professional, okay? You do not know whether how that advice is going to work for him. So refrain from giving advice, but at the same time, be a good listener. Listen actively to that person, understand his problems. You know, you could just say, I understand what you're saying. I know it must be difficult for you. Talking like this helps rather than saying, oh no, just snap out of it. What you're feeling so depressed about, come, let's play. No, that's not going to work. So active listening could definitely help the person.
We're waiting for questions actually.
Pardon?
We are waiting for questions. One moment.
All right.
If anyone has any questions, they can please type it in chat section.
Host.
One question that is common. There is someone in our life who is consistently upset and who is also struggling with her family. So, what can we do to help her?
That is, if you know someone who is upset and struggling with family.
Yeah.
Is that the question? Okay, now you have to understand the intensity of that situation. If you can take the person to a therapist, that would work the best because you not being the professional, you may not understand what works better. If the family is supportive, then you can try talking to a family member and make that person aware of the situation in the house, because obviously that person is living with family. Or if that person is not so comfortable with his family, then I think seeking professional help is the only way. See, there are lots of services available now who provide free counseling services. There are services which are 24/7 also. So try reaching to therapists. I wouldn't ever advise you that if you're not a professional, please don't go about and give advice to the person.
I think we'll end this session here.
Uh,
I think this was a very fruitful session, and before ending the session, I would request everyone to kindly fill out the feedback form, after which will be, the link will be given in the group. We would also, with due regards, like to thank Ms. Yusra Sayed and team of MySafe Therapy for doing this session with us, which was much needed during this time of pandemic. And for any further help or counseling, you can always contact her or ping her at her Instagram page, MySafe Therapy. A heartfelt thanks to the team of Project U for carving a way to focus better amongst the frontline COVID warriors and medical practitioners. We would also like to thank our Leos from the neighboring clubs for supporting us and the district for providing us with the Zoom ID. Thank you so much, everyone, for joining us. We hope to see you in the next session as well. And please fill the feedback form also.
Yes, you can end the video, end the meeting.
Yeah, a small notice to everyone. The link to the feedback form has been put in the chat. All the viewers are requested to please fill it before you exit this meeting.
Hello. We have a question from our user, from our participant, that what if anyone is feeling that they are not having any future in his life or her life? So, how can someone get out of that concept?
Yeah. Now, this could be very subjective. So, just me giving out answers wouldn't work like this, because I would need to talk to that person personally and understand that what are the factors which is causing him to feel like this. Okay. So, I think if that person would be able to contact me, that would work better.
how to avoid emotions, negative emotions, when you are getting cheated on by somebody.
So the question is how to avoid negative emotions when you feel you're cheated on.
Yes.
See, the very fact that you are cheated on, it's not easy to overcome the negative emotions, because definitely you're going to be hurt. You're going to feel all sorts of negative emotions when you're cheated. So the best thing you could do is try talking or confronting the person directly who has cheated on you. Ask him, or ask him or her, whoever it is. It's not easy to get over your negative emotions, and you cannot snap out of it immediately. You may take some time. You will have to give yourself some time to heal and recognize and understand that it is not worth it to waste your life upon someone who actually cheated on you, because that is not something you expect out of a relationship. So you cannot just snap out of negative emotions this way. You will have to use active coping skills, and you will have to understand the situation even more better. And the best thing is to first confront the person. When you talk to the person directly, there itself you feel a little more empowered about it, that you already know something. So I would say that you have to give yourself time to overcome the negative emotions.
Okay, I think we should end this here. Thank you everyone for attending. Host Yash, can you end this?
Thank you so much, everyone, for attending it. Thank you, Yusra.
Most welcome.
Yash, please end the session.
एंड करू का काय एंड करू
हो हो
You can contact ma'am by there's a contact given in the feedback form, so you can contact over there on her email ID or either on her Instagram page.
अबे एंड करू क्या
Yash, yes.
You are unmuted, yes.
ओके